Hi everyone, Happy New Year's Eve. I wanted to just address the eye care professionals out there about what I found out about Wolbachia and what is known and what is not known. I was surprised on the AAO site to find that a couple of MDs had written that it's the body's reaction to the parasites that damage the eyes, leading to blindness. That's not entirely true. So I wanted to just show some proof of that. In 2002, it's the bacteria that causes river blindness. Wolbachia microbes play a major role. And on this study, the role of endosymbiotic Wolbachia bacteria in the pathogenesis of river blindness, the predominant inflammatory response in the cornea was due to species of endosymbiotic Wolbachia bacteria. And the American Society of Microbiology new evidence that the worm is the innocent bystander. In fact, I found out that this worm can live for decades without causing much damage in a human body. However, now what we have is the EPA allowing Wolbachia to be put into the Aedes genus of mosquitoes and be released into the environment. So they've taken out the worm and put the most damaging part right in the mosquito. And again, clearly, river blindness results from the immune response to the worm's endosymbiont, which is Wolbachia. Moving right along. This was a very key point. From January 2011, the neutrophils attack the bits of bacteria, the Wolbachia, that linger outside the worm. And of course, antibiotics are what work with that, and oddly enough, azithromycin and nanchamycin has been found to work with Zika, which kind of strengthens my argument that Zika is a phage working in tandem with Wolbachia to cause the worst manifestations of what's known as the Zika virus cases that we have. So doxycycline was one of the more effective treatments, and then minocycline. And another team compared doxycycline, minocycline, and so on, and found that 3 weeks worth of doxycycline was more useful. Now I found this, and I thought they were getting awfully close to figuring out there's something else going on here. Nodding syndrome may be only the ears of the hippo, and I invite you to read the whole thing. I can only use 3 snippets here. That it's unclear how river blindness might cause nodding syndrome because the worms and the adult worms are not generally considered able to invade the central nervous system. So that's the brain and spinal cord. And that nodding syndrome may be a very severe form of a disease that manifests in children because of their susceptibility in immature nervous system and immune system, and high exposure to the byproducts of the worms, which is Wolbachia. Okay, and they speculated that that Wolbachia, or an unknown neurotropic agent transmitted by the black flies, needs to be investigated. Well, I'm speculating that's Zika, based on a number of things. Now, I want to draw your attention to my statistics on an article I wrote devoted to men. And what Zika does, it drops the testosterone levels, can cause infertility, groin pain, prostatitis, blood in the semen shows up. And New York is recently way up to number 3. Quezon City is actually in the Philippines. It's where the most homeless people in the world are, including 1.2 million children. So because of the correlations I'm seeing in other places in the world, and California has an increase in December in Zika cases, which makes no sense because Aedes aegypti are not supposed to be alive then. So that again points to the Culex species of mosquito. Now, here's my speculation of what ophthalmologists and optometrists and eye care professionals are going to see in the New York City area and Toronto, because we're awfully close. Mosquitoes don't respect boundaries, and these are about 9 things I've researched that come up with what Wolbachia does in the eye. So I want you to take a good look at that. I have a hard time pronouncing these, so I think what if you see that in young homeless people, you want to rule out Wolbachia and or Zika infections. And this is from 2011. I like the way it's written because it's 3 sentences that encompasses the anterior and the posterior chambers of the eye, or segments of the eye. That corneal pathology begins with fluffy or snowflake opacities, and then the dead worms can cause uveitis with the formation of synechiae, cataract, and glaucoma. Now, interestingly enough, with Zika, uveitis has been reported, and so has glaucoma. So I don't know how much of that's attributed to the worm or the Wolbachia just emitted outside the worm. But now they've removed the worm and put the Wolbachia right in the mosquito, as I said. So I want to include this because I know there's some fabulous retinal ophthalmologists out there that will understand this. Posterior segment lesions include atrophy of the retinal pigment epithelium, choroidal retinal scarring, subretinal fibrosis, and post-neuritic optical atrophy. And I just found that today. Another one I found today was that indeed it appears to be that river blindness keratitis, it's the presence of the bacteria was essential for neutrophil-mediated inflammation, opacity, and corneal haze. So when you have patients that are, not going to Africa and they're only like 8 years old, and you're seeing corneal opacities and wondering what's going on here, maybe the course of action to look at is Wolbachia Zika infections, because this has been quite ignored, and I'm being quite a lot of opposition to this theory, in fact. So a short course high-dose rifampicin achieves Wolbachia depletion, and this is in 1 to 2 weeks. And I want to put this up on the screen for you, what they're saying here, because it does appear to be very effective. And as you know, 6 weeks worth of doxycycline is not doable for the very young or pregnant women. Now, this kind of disturbed me, is that when I read about how they came to their conclusions, what they had done is to generate the life cycle, they used mosquitoes and gerbils. And to generate the infective larvae for infections, female adult Aedes aegypti mosquitoes were fed the microphyllae collected from infected gerbils. Now that kind of shocked me, because I was under the impression that Aedes aegypti couldn't transmit the worm, and that only the Kulik species could. So I wanted to show you that. It's very disturbing to read that, to tell you the truth. Now again, I want to remind you of the areas the EPA has allowed mosquito mate to start releasing these, and they're going to start in Kentucky. It's going to go south to Tennessee and all the way up to Maine, right beside New Brunswick, Quebec, Ontario. And the releases in California are going to expand and be in Nevada. And in fact, I understand they're going to apply for nationwide release. And I think this is a nightmare waiting to happen, to tell you the truth. But I wanted to remind you just how close we're getting. Now, these mosquitoes are the Kulik species, and they use mosquitoes in those areas, which is very key. Because what I found is you can almost mix and match mosquitoes with the various Zika strains to get the desired result you want. And you got to use the mosquitoes in that geographic area and test them for Zika and or Wolbachia. So those 5 research teams, independent research teams, have concluded Kulik species are able to transmit Zika, and that in fact, Zika is more related to the encephalitis viruses. Now, I wanted to address another thing about lymphatic filarial disease, is that what it does to men. And in 2012, they found that this microfilary can interact with dendritic cells and natural killer cells and induce their apoptosis, which is cell death. And I think that's kind of huge. That's bordering on what Wolbachia and Zika are doing. And I wanted to show you what it does in men. A notable point is that fever is not usually present, but pain and tenderness in the affected site is common. And induced cell death in human dendritic cells. I mean, this is looking a lot like what Zika does to these infants. And I wanted to leave that for those who know quite a bit about toll pathways and so on, and the cells involved in the immune response of the human body. So here's what got me wondering what's going on here. In 2010, I remember this, blindness and visual impairment was decreasing worldwide. Well, now there's some huge projections that's going to be horrible, and I'm thinking, what's going on here? And one study I just found today was that 75% of global blindness, the cases are now in Southeast Asia. Now, Southeast Asia is the one that's had the most Wolbachia-infected mosquito releases thus far, and we're next. And we need to look at what's going on there. And sure, we can start to say, well, river blindness happens there because, black flies and whatever. But get this, they're starting to do, you put this Wolbachia into the Aedes genus, it's starting to cause encephalitis type symptoms. And this really fits with Zika. So I wanted to devote this to the ophthalmologists out there. I'm not an ophthalmologist, so I wanted to just share what I know and what I've researched, because I think in the next few years, maybe sooner, because New York is so high up on my list of organic hits, that you're going to see strange corneal opacities probably, and strange retinal things going on in the very young and homeless populations. And one type of Wolbachia they're using in these releases, in fact, with increased temperature, it migrates to the optic lobe and retina. So I thought the ophthalmic community should be up to date on what's going on with Zika, and perhaps my Wolbachia theory will be proven eventually. But thanks for listening. I'm hoping this helps.